Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Shrindri Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. So we were discussing about the dosha, clinical understanding. Question comes, what is dosha kshaya? In the last class also I told Kshinaha Jahati Swalingam. So Kshina doshas will going to lose their natural qualities or original qualities or functions. Now, what is dosha kshaya? When there is dosha kshaya means sa alpi bhutaha. That means they are less in number. Amount will be less. So individually we cannot start their that means the doshas are less in number, less in amount or quality, whatever. Therefore, that particular decrease of dosha is individually not in a position to create or initiate any of the samprapti. Vruddha doshas can initiate a samprapti, whereas Kshina doshas are not in a position to initiate any samprapti. If other aggravated doshas are there, okay, if other aggravated doshas come and combine with these Kshina doshas, then it may lead to the production of a samprapti. For example, in case of Sannipata Jvara. Okay, kapha and pitta is increased, vata is decreased. Now vata kshina, but kapha and pitta is more. Now it may lead to sannipata jvara. That's a different issue. Otherwise, if there is no any aggravating other doshas coming and influencing it, individually, that dosha which is lost its original functions cannot able to initiate any samprapti. So once there is no samprapti, there is no production of any disease. That's the reason why a Kshina doshas will not able to produce a disease. Now, by functional assessment, if you see how to assess the Kshina doshas, one example I told in the last class, uksaha, normal function of the vata, and there is loss of uksaha, enthusiasm loss, that leads to vishadattva. Okay, karya siddhi, vishada means karya siddhi, bhaya asiddhi. That means he is not able to, so he is not having confidence to initiate any function, vishada. Okay, so that means he is worried about the successful completion of any given function or action, and that is vishada derivation. Okay, it may be vatakshaya, it may be kapha or kapha vruddhi. The diagnosis is kaphaja unmada. Now see, dosha kshaya is not essential for the diagnosis. Dosha kshaya is not a disease at all, so there is no diagnosis required. Okay, so whenever there is Kshina doshas are there, what is the treatment that you have to do? Suppose we have identified the Kshina doshas, for example, uksaha and vishada. Vishada is there. The treatment is, it's a Kshina dosha, so we have to bring that particular doshas to the normal level, isn't it? So Brahmana treatment should be done. So Brahmana treatment should be given for the dosha kshaya. Next we come to another part, that is what is dosha prakopa. So dosha prakopa means when a dosha got a capacity of roga utpadaka samarthya. A dosha is able to now produce the roga. Okay, a samprapti can be initiated, formed and carried out. So that is called as dosha prakopa. Okay, linganam darshanam teshaha. So now doshas start producing some of the symptoms. Symptoms are nothing but the expression of the gunas. Okay, or dosha prakopa is also conditioned to aswasthya condition. Altogether, it is called as prakopa. When the doshas got a roga utpadaka samarthya, when the doshas start exhibiting their lingam, linganam darshanam tesha, and creating a aswasthya or a disease-like condition, pathological condition, so that is called as dosha prakopa. In kshaya, there is no roga, although linga and aswasthya is there. Now this is very important. In dosha kshaya, in dosha prakopa, all these three things are there. But in dosha kshaya, there is no roga. But in dosha kshaya also symptoms are there, isn't it? If in vata, uksaha is lost, vishada, the symptoms are produced. And the patient is also ill looking or sick looking, aswasthya. But still it is not considered as roga. Okay, still it is not considered as a roga. For the Roga Utpadaka Samartya should be there. So if I say Prakopa, there is Roga Utpadaka Samartya is there. In Kshaya, there is no Roga Utpadaka Samartya. Therefore, it is not considered as a Roga. Next we come to another part, that is Dosha Paka. So what do you mean by Dosha Paka? Dosha Paka is mentioned in Madhu Kosha. So Dosha Paka is assessed by Dosha Prakriti and Vaikrityam, attainment of a Nirama stage. Usually when we discuss when there is attainment of the Nirama stage, Dosha Paka. Now, Lagutam Juradehayu, Indriyanancha Vaimalyam. Normal functioning of the, suppose the normal function of the Indriya has been disturbed. Now again it comes back to the normal stage. Okay, so then we will say Dosha Paka has been taken place. Okay, in case of Jwara, if you talk about Lagutam Juradehayu, a patient once he start feeling Lagutva in the body, that suggests that Dosha Paka has been taken place. Dosha Prakriti Vaikrityam, attainment of the Nirama stage. Okay, so essentially in the prognosis and management of the Jwara, especially Dosha Paka is explained in context to Jwara, in relation to Jwara, because in the Jwara, for the assessment of the prognosis and also for the management, Dosha Paka is very important. Doshanam Paka Lakshana. Okay, this is one important thing. Now Dosha Paka is bringing the abnormal doshas back into the normal stage, whereas Dhatu Paka is exactly opposite. It's a pathological stage that we'll discuss later. What is Dosha Prabhava? Now this is also important. Dosha Prabhava. What is the Dosha Prabhava? Vata is Amurta, isn't it? There is no particular structure for the Vata. Okay, so Vata is Amurta. But we are telling that Vata is Aruna Varna. Many times Vata is Aruna Varna. Vata, although Amurta, we say that this Vata is produced Aruna Varna. So now it is Amurtha. This is the Dosha Prabhava. This is how we are telling that this is having Aruna Varna, that is by means of Dosha Prabhava. Similarly, Pandu. Pandu basically Pitta Vyadi. Okay, so we are discussing about Dosha Prabhava now. Similarly, now we will see example for Vyadi Prabhava. Then the things will be clear. For example, in Pandu, Pandu is a Pitta Vyadi, basically Pitta Vyadi, but the patient is feeling Shita Dvesha. Patient is having Shita Dvesha, isn't it? In case of Pandu. So that Shita Dvesha, that is because of Vyadi Prabhava. That's a different issue. That is that production of the Shita Dvesha in the body, that is by Vyadi Prabhava. In Chinna Shvasa, if you see, Raktaika Lochana. In Chinna Shvasa, patient is having Raktaika Lochana. That is also basically because of Vyadi Prabhava. So Vyadi Prabhava and Dosha Prabhava is different. Okay. For the Dosha Prabhava, we'll get one example, that is Vata, although it is Amurta, we don't have any particular structure for the Vata, but still it produces Aruna Varna in the body. We say that it produces Aruna Varna or Nila Varna, whatever. So that is Amurtatva. So that is the Dosha Prabhava. Another important thing is what is Dosha Gatha and Dosha Lina. Dosha Gatha and Dosha Lina. Gata Dosha. Kupita Dosha reaching any adhisthana of the body. Kupita Dosha reaching any adhisthana of the body. Dhatu, Ashaya, Mala, Indriya, etc. wherever. So then we will call it as Gata Doshas. When an abnormally vitiated doshas, so then when they reach any of the adhisthana, other adhisthanas of the body, so then we will say Dosha Gata or Gata Doshas. Okay. Another term is Dosha Lina. Dosha Lina means Ekadesha Shlishta. It's called Dosha Lina. That means doshas are get stagnated at one particular place. Doshas are get stagnated at one particular place. Then we will call it as Dosha Lina. Therefore, it is called as Vishamajvara. In Apasmara, Ekadosha Shlishta. Okay, the doshas are get stagnated at one place. Linatva Karsha Daurbalya Ya Vaivarnya. Linatve Karsha Daurbalya Vaivarnya. That is in case of Jwara. So Jwara, when it gets lean in particular area, stagnated, then we will have Karsya, Daurbalya, Vaivarnya, etc. So this is a small difference between Dosha Gata and Dosha Luna. Dosha Gata means the doshas are moving from one adhisthana to another adhisthana. Dosha Lina means doshas are stuck up there. Okay, so they get obstructed or they get stuck up there, stagnated at a place. And when such situation is there, we will have the symptoms like Vaivarnya, Daurbalya, Karsya, etc. which is normally seen in case of Jwara Lina Lakshanas, in the Dosha Lina in Jwara condition. Another important part is what is Sama and Nirama, Sama and as well as Nirama doshas. Now, these are actually two types of presentation of the doshas. When initiation is by Ama only, when there is initiation by Ama only, then Amaja Vyadhis are produced. For example, Amatisara, Amavata. The whole initiation of the Samprapti is by means of Ama, not by the doshas Ama. Okay, so when initially the dosha Kopa occurs and then there is Agni Mandya, then there is formation of Ama. So this is called as Nirama doshas. So Ama doshas, Sama doshas and Nirama doshas. Okay, we have got certain disorders which is basically Sama doshas. Some of the Nirama doshas. Now Amatisara. Ama itself is a cause for the Atisara. Amavata. Ama itself is a cause for the joint pain and all those things. Okay. The involvement of the other doshas and involvement of other dhatus is a later part. Previously there is Agni Mandya. Agni Mandya leads to Ama. That Ama itself created this problem. Amavata, Amatisara. So we will call it as Sa Amavata Lakshana or Sama Lakshanas. Whereas in maximum conditions, Nirama doshas, Ama formed later. Initially there is Dosha Prakopa. Dosha Prakopa leads to the reduction in the capacity of the Agni and there is formation of the Ama later. Okay, Sama Amatisara or Pittatisara. So these are the examples for Nirama doshas. Okay, so this is very important aspect in consideration of the doshas. The rest of the part we will see in the next class. Thank you.